enter the room.
Hello,
Hi.
I'm Dr. Lisa. I'm one of the doctors in this GP surgery. Are you Hal Harley?
Yes, that's me, doctor.
Mhm. May I know your age, please?
I'm 19.
Okay, so is it okay to call you Harley?
Hal is fine.
Okay, so Harley, I understand that you wanted to speak on of the doctor. So how can I help you today?
Well, you see, doctor, I think I'm having a little problem with concentrating, and it's kind of something that I've been having for a while, but then now it's kind of affecting my life. So I just want to understand if I can do if there's something that you can do about it.
Mhm. Okay, so since how long you're having difficulty in concentrating?
Actually, it kind of started from, middle school onwards, I would say. I was really interested in maths, but then after a while, I just found it very tedious to continue. And yeah, things like that, I can't, I feel I can't concentrate on something for too long.
Mhm. Okay, so uh, so it's happening continuously, am I right?
Yes, it is. In fact, just the
Okay.
other day, I left the stove on for so long, I completely forgot about it. I mean, I thought I should come and talk to you about it.
Yeah, you definitely did a good thing to come here. We'll definitely help you with this.
Yeah.
So before that, I'd like to ask few more questions to understand better. So can you please tell me, apart from you, any other people notice it that you're not concentrating on your study?
I mean, it's not just studies per se. Studies is what I'm concerned about because I'm in uni right now, you see, and
Mm-hmm.
I think it might just affect me badly academically as well. But I went to the college uni nurse, and she said I should probably go to the GP. So I'm here.
Okay. Okay, so do you like usually forget easily anything?
I mean, yeah, I would say so.
Mm-hmm.
But I think that's something
Like,
that everybody does. But yeah, I find it difficult to concentrate mainly, I would say.
okay, okay. So does it happen like when teacher is taking the class that time everyone is sitting, but you feel you are lost in the concentration like this?
I think for a while I can understand, but then, you continue. I can't keep you listening to them for a long time. I mean, I just phase out.
Okay, okay. I can see that you're a little bit like some kind of like fidgeting your hand like this. It's happening always.
Um, yeah, that's all. I've always been like that. Yeah.
Mhm. Okay, so I want to ask few more question about your like your birth, like when you were did anyone tell you that you born prematurely?
Oh, no, I was fine. I think I was a term baby.
Mm-hmm. And by any chance your mother's was smoking or anything?
I don't know, doctor. I mean, I don't think I've had that conversation with her. But can you tell me
Mm-hmm.
what it is? I mean, do you think you know what it
Okay.
is? Is there something
Yes,
you can do about it?
yeah, I would like to. I'll go for it. So what? So do you have any idea what might be the cause of this?
I'm completely clueless. That's why I came here.
Mhm. And how did it affecting your life? Like,
Like I mentioned, I'm actually worried that it's going to affect my, performance academically.
mm, yeah, yeah, it's really worrisome for you. Okay, so I'd like to examine your I'd like to examine your vitals. It includes your oxygen, blood pressure, temperature, and heart rate. Okay, so Harley, from what you have said, and after the examination, it seems like you are having a condition called this attention deficit hyperactive disorder. Do you have any idea about it?
Yeah, I've heard about it, but I don't really know what it is.
Okay, I'll explain to you. So, deficit hyperactive disorder, that means that um, you'll it is a condition in which usually
Any
people
cure, doctor? Is there a cure for these things?
yeah, definitely there is we can help you in many ways. So first of all, we can refer you to the specialist, uh, mental health
2 minutes
specialist.
remaining.
Then they will assist you and they will do some more tests and to find out the cause, and they will give you medication for this, and you need to take this for quite a long time, and you also need to we need to monitor you. So do you understand?
Yeah, what do you mean medication? What medication is this for?
Um,
And what do you need monitoring for? I don't get it.
yeah, because we need to monitor you because sometimes so may I ask you to drive?
Yeah, I drive. I mean, that's how I got here.
Yes, okay. So sometimes it may make some drowsy or some hyperactivity. So whenever you are driving, so we'll give you this medication. The medicine you are taking will give that information with you. So whenever anyone like if you need that time, you can show them. So so that there will not be any trouble.
Will this improve my academic performance? Do you think so?
Yes, definitely. When you start to taking it, you'll feel better, and you need to take it regularly. So after that, your life will be better, and yeah, definitely this will help you.
Yeah, and you mentioned some specialist guy. Who is that?
Okay, so this is the mental health specialist. They will assist you, and after that, they will give you this medication.
Is it a mental problem?
Um,
Move on to the next station.
All right, Dr.
I'm
Father.
sorry, I totally forgot that.
Yeah, that's
Yeah,
all right.
so
That happens. That does happen in the exam as well. You don't know what to give these people. Like you're sure what the
no,
diagnosis, but then you
sorry,
figure
okay.
you don't understand what to do next. But yeah, that's also something that you should learn how to tackle. But this was a great performance. Good
Sorry.
job.
I forgot the name actually.
So, a
I
couple
forgot
of
the
things
name.
I'd like
Yeah.
to say before the examiner takes over. So, the things that, so you understood that this was an ADHD case, right? So, when did you understand this was an ADHD case? Like, how much into the consultation?
Sorry?
I mean, how long into the consultations did you understand that this was an ADHD case?
This is when you start talking
Okay,
from
when I
that
started
time.
talking.
Yeah.
That was an easy reveal. All right. So, couple of things. Even when you even look at the question, so we have the examiner again. So, even when you look at the question, you have a couple of clues on what this case can be. So, this question is not giving you much information. So, it's something. So, when the scenarios, when the question doesn't give you information, it's usually a psychiatric scenario, or it could be like an STI kind of a scenario where they are ashamed of telling, the person who's writing down, what the symptoms and what the presentation is. They don't tell them very easily. They just want to talk to the doctor, right? So in that case, you'll understand that this is a kind of a difficult situation. Maybe if it's a psychiatric, they won't have insight, and if it's an STI case or something like that, then you will have to give them a lot of management, and you will have to explain them a lot what it is, and partner protection and all that, right? So I think if you understand that, then you will get an idea that this could be a psychiatric case. So think about all the psychiatric problems that 19-year-old would have. So a couple of clues that you have is it's Hal Harley. Yeah, it could if the gender also might have been mentioned, then you would have had an idea that this was a male, and so that rules out PMS because that's again around that age, right? So it's something related to psychiatry, but for a 19-year-old male, right? So when you think about it like that, then you would understand how to approach this case, right? Couple of important things. Since you understood what the case was, you were diving into a lot of data gathering. You asked a couple of questions, which was good: inattention, concentration, and hyperactivity. Hyperactivity you got from the mentioning the hand movements and stuff like that. But once you understand, just ask one or two symptoms to understand what this is. Because once you understand, you have to rule out a lot of things. So you went into birthing history and stuff like that, but this is not a pediatric case.
Okay.
Right? So you were getting confused that, which direction should I go into, a normal consultation or a pediatric consultation?
Okay, that is, I thought maybe ADHD there is a link that prematurity may be the cause. Maybe I just went on direction. That's the problem. Yeah.
Yes, but you ultimately, rather than investigating the cause, you understood what it is, right? At this point, when a person comes to the GP, they also want to understand what it is. You also want to tell them what it is, right? So the couple of symptoms that you have is good enough, and you have to rule out other problems. Like, are you hearing sounds? Is it not schizophrenia or anything like that? Because those are the most dangerous things that can come in psychiatry, right? Mood and all that. You need to keep asking, like, how are you feeling? You're not depressed and all, right?
I always think of differentials. You didn't think of any differentials.
Yeah.
Because you did
I
manage
understand
to
now.
you did manage to take out a couple of symptoms for ADHD. That was good enough. But then now you need to rule out the other things that it should not be,
Yeah.
right? That way you're being safe. Do you get that?
Yeah, I understand. I understand.
Yeah. And
Okay.
yes, examination usually we give vitals and stuff, but this gave a little bit of shaking and stuff, but you understood that yourself. And after that, you went into explaining the patient. All right, now the examiner will take over. I'll also
Thank you.
stick around.
I like the part one.
Hello.
That was a really nice performance. That was really good. I think you kind of understood the case, and you kind of had a lot in mind already to ask. That's actually a good thing because this is a very specific thing I noticed I wanted to teach you. So normally data gathering is something we do when you don't know what the diagnosis is, right? So those are the most difficult cases normally for anyone. They would think that, okay, what do I do if I don't know the diagnosis? What questions do I ask? But if you think about it, these are the cases where you know the diagnosis from the start. These are the actually difficult ones because it's never that easy. Because if you know that you're getting the diagnosis in the first question, that means there's something else. There's definitely something more that you need to gather from the patient. It's not they don't want you to ask about that diagnosis because they're not testing your knowledge. They're only testing to see if you're a safe doctor or not, right? So we'll just go through the performance once. I'll just cover the points that I wanted to specifically mention one by one. So introduction was really good. You asked the full name and age. That was really good. And I think you misheard. So she said Hal is fine, and then you still continued calling Harley. But I think that you didn't hear properly. But yeah.
Okay.
that sometimes can hurt, your listening. You might get a tick in the listening. So best is to just not ask that. So when the patient directly says, so when you ask the name, they usually say what their preferred name is. So when they say, so suppose when you ask, is it Hal Harley? Yes, I'm Hal. Then you just start calling them Hal. So if they don't say anything, if they don't tell you, then you can call them Mr. Harley, or you can directly call them a first name. It's not a blunder at all. So don't worry too much.
Okay.
Don't waste time in trying to confirm what they want to be called. It's only important in a case where there is transgender or gender dysphoria, where they specifically want to whether you will ask the right name or things like that. So, so that is something that you should try to reduce your time there. And data gathering. So, always start with the presenting complaint. That's good. You ask the presenting, you found out the presenting complaint, and immediately, as soon as I want you to keep this in mind, this is usually they'll teach us in medical school, which is basically whenever you hear pain, ask Socrates. Whenever you hear anything else, ask Odipara. Right? Do you know the mnemonics, Socrates and Odipara? These are very, very important because what happens is we think that this is something very common. We might not pay much importance to this. So what happens is whenever you feel like, okay, I know this, so I need to ask about the risk factors, I need to ask about differentials, but do not skip into that point without asking Socrates or Odipara. That's something they're very specifically looking for, which is
Okay.
structured data gathering. So if you don't ask at least 2 or 3 questions out of Socrates and Odipara, which is basically something the patient hasn't already told you. Like if the patient has already told you so when in this particular case, she already told you that I've been having this from a lot of time, and then recently it's been getting worse or things like that. So it's already you've gotten the onset and you've gotten the duration somewhat. So don't again spend time asking those questions again. So immediately ask, is there any other associated symptoms? And is there anything in particular that you notice worse and makes this worse or makes this better? That's all. Just quickly ask 2 more questions. And then what is the next thing that comes in data gathering is, so presenting complaint, elaborating the presenting complaint. Immediately after that is differentials. So never skip differentials. Differentials is very, very important because that's where most of the you're showing your safety, showing that you're a safe doctor comes in your differentials, because most of the times the patient comes with a problem. They will come to you only if they think that it's something else, something that serious, right? They usually don't come to you with if suppose they have a headache, they'll just take a pill and they'll come, right? But they'll just take a pill and they won't come. But if they are coming to you, means that they think that this is something more serious. So that is something that you have to keep in mind, because they have a diagnosis in their head, which is something that you need to ask by using ICE, which is ideas, concerns, and expectations. That is also something that you skip. You asked, what do you think it could be? But make sure you ask the other two, concerns and expectations. You didn't ask, right? Always go through the all 3 things, because that is something that all. So, for example, if you see the patient info, so there's always a heading that says ideas, concerns, and expectations. So the simulator always has this in their clipboard. So they're waiting for you to ask these questions. Okay, that's very important. Now, coming to differentials. So this is a very easy thing if you don't know the diagnosis, right? If you don't know what the diagnosis is, you'll end up asking a lot of questions because you need to find out what it is. But when you know it, so there's a very easy way to remember this, which is 3 C's. So whenever you know the diagnosis, always ask one question for 3 C's. 3 C's are common, critical, and cancer.
Okay.
Okay, remember it that way, which is what is the most common condition that could be causing this symptom or this set of symptoms, right? That is your common, which in this case is ADHD. So you already got that. So that is the main diagnosis. So you already asked a couple of questions for that, which is so I'll come to that specific questions for the diagnosis. But before that, you have to do differentials, which is So other common thing that can cause this loss of concentration is
This is schizophrenia.
no
Like
depression.
loss, depression, yeah.
Depression is very important. So whenever you're thinking of any psychiatric case, always think about depression, because depression is the most dangerous psychiatric condition, because it's very silent killer, right? Like, no, lot of people will ignore it till it becomes a big problem. So most of the people will just have very mild, very like, you won't even think that it's depression. It's just random symptoms they'll come up with. But always keep depression at the back of your head. Always ask mood, anhedonia. So what is anhedonia? Is basically, do you feel like you're losing interest in the things that you used to like? So these are the two questions that you have to ask. How is your mood lately? Any psychiatric case, make sure that you ask these two questions. And next, that is common. Then next C is critical. So what is critical in a psychiatric case? What do you think is life threatening in a psychiatric case?
That is schizophrenia or suicidal thoughts.
Suicidal
Like
thoughts, exactly.
yeah.
Yeah. So schizophrenia is fine. It's another diagnosis, but always think about the most common thing, which is depression, and then most critical thing is suicide risk, which is basically life threatening, right? So always ask any thoughts of self harm, and make sure you signpost before asking this. This is very important. Most people don't, think about signposting here. Most people only signpost for smoking history and drug history, but self harm is something that's very triggering. So always signpost that. Always say things like, a lot of people that go through tough times sometimes think about harming themselves. And is that something that you feel? So that's a nice way to put it, where you are saying why you are asking that question, right? That's what signposting is. So you're indirectly telling them, explaining them why you have to ask that question, basically. Then comes the third one, which is cancer. So in this case, there's nothing that indicates cancer, but always ask weight loss, because this is a chronic symptom, right? She's been having for a long time loss of concentration. So if you just ask weight loss, then cancer is ruled out for now, at least, right? Then only you go into confirming your diagnosis again, which is going deep into ADHD symptoms. Which is, have you been
Okay.
having any inattention? So right, because so far you've ruled out everything else, which are very, very dangerous. Now you are coming. Now you are more sure also. Now you are sure that, okay, this is definitely ADHD. So now we have more. Like, you don't have much time now. All you can do is just ask two symptoms, which is one from inattention, one from hyperactivity, right? So inattention comes careless mistakes, difficulty maintaining focus, and forgetting tasks. For hyperactivity, fidgeting, restlessness, excessive talking. So I'm not sure if you asked this, because I didn't hear any hyperactivity questions. But
Yes, that's I think I'm seeing like you are fidgeting your hands. That one I
okay,
asked.
that's good. Okay, yeah, yeah. Then that's covered. That's perfect. So that's just so now we have a structure, right? Always start with
Yeah.
presenting complaint, then elaborate the presenting complaint, which is nothing but Socrates and Odipara, right? You just have to
Yes.
show the examiner. So this is also very important. You're not showing the patient. So don't think that you are showing the simulator doesn't know anything about what the structure should be or what questions you need to ask. So always ask the questions in terms of the examiner. So think about, so whenever you're thinking about elaborating presenting complaint, make sure that you show the examiner that you're asking, okay, I'm following a structure, which is I'm asking about site, onset, character, radiation. Similarly in that form, but if the patient is wasting your time, for example, if the patient is telling you like, why does that matter, why does how long I have it matter, or something like that, don't dwell on that, because you've already shown the examiner that you have a structure, you asked what you need to ask, just move on. Immediately just say that, oh, I'm so sorry, I'm just asking because I need to get a full picture, and then go to the next set, which is PMAFTOSA. So PMAFTOSA is basically past medical family
Yeah,
history.
that is also I didn't ask.
You asked about birth history. So always think about what is more important here. So in this case, so since you already have the diagnosis of ADHD, so at this point, uh, suppose if you had ruled out all the other things, so now you almost sure that it's ADHD. Now, so what are the important things in PMAFTOSA you need to ask at this point? So past medical history is very important because any past psychiatric history specifically, right? That's very important. That's something you have to ask. Medications is very important. That's something you have to ask. And allergies is something is not that important at this point. But family history of psychiatric illness is also very important, right? Just three things: PMF, and one very important aspect of PMAFTOSA that you have to ask in every single case. What do you think that is? Especially in PLAB 2.
Social, psychosocial history.
Exactly, yeah. So living situation, psychosocial history, which is very, very important. So never skip that. You can skip family history, you can skip drug history, smoking history, all that, but never skip psychosocial history. Okay. So always ask any because especially it's a young patient. Make sure that you, if it's young or elderly patient, always make sure you ask about support system, right? Who stays at home with you, and how is everything at home? That's all. Just two questions. All right. Then your psychosocial is almost covered. Now occupation or daily activities, which is how is it affecting your life? So that's a very you ask that, but that's a very important question that you have to ask, which basically tells you how the it tells you a lot of things, how severe the symptoms are, what is the state of the patient, like is do you need to do anything to help the patient other than just treating the illness, right? It's not just
Yes.
treating the illness, right? Because if they don't have a house, you need to arrange that. If they don't, if they can't work, if they can't go to work, you have to arrange something for that. All right, there's so many aspects of that. How is it affecting your life? That is very important before you go into management. All right. So, so going through the structure again: presenting complaint, elaborating the presenting complaint, differential diagnosis. So, differential diagnosis specifically three C's: common, critical,
Common,
cancer.
critical, and cancer. Okay.
Awesome. Then, and then go into within the specific whatever your diagnosis is, within the diagnosis, if you want to ask any more questions, you ask those, but do not waste time on that. Like if you can't think of anything, just move on, go to ice. All right, either ice or PMAFTOSA. So next is PMAFTOSA basically. So so what I usually tell is, if you can't think of anything, just ask ice. So that's a very easy way, because while you're asking that, you'll think of things to ask. So it's a nice filler in between. So then you go into PMAFTOSA, and then psychosocial specifically in PMAFTOSA, and then how is it affecting your life, right? Then your data gathering is done completely. All this you have to somehow fit it into how much time do you think?
5 minutes.
4 minutes. Don't even think about
Okay.
5 minutes, because when you think of 4 minutes, it'll end up going to 5 minutes. If you think of 5 minutes, it'll end up going to 6 minutes. It's very hard to control. So keep a much lower threshold. Keep it at 4 minutes. So because if you think about it, there's three domains, right? Data gathering, management, and interpersonal skills. So interpersonal skills is something that you will be doing throughout the station. So that is something that is already covered. Now data gathering and management have to come equally, right? So you have to have 4 minutes for data gathering and 4 minutes for management. So always try to keep that. Now, sorry. Other than that, specifically in the ones that you missed is differentials that you missed, hyperactivity symptoms that you asked, okay, and background and substance use. So here substance use also is a little important, but it's all right. So always think, make sure that you're asking the most important questions, which are life threatening to the patient immediately, if you have to prioritize, which is basically self harm in a psychiatric case, which is self harm more than alcohol and recreational drugs. So think about it that way. Okay. Next, in management, you explained what ADHD is, but there was a big mistake that you did, is that you gave the diagnosis of ADHD. Never do that. You can't diagnose ADHD. You are not qualified
Okay.
in the first place to diagnose ADHD. Alright, they have only a psychiatrist can diagnose it with a proper questionnaire, and they have a lot more criteria to diagnose it as well. So, best bet, whatever it is, even if you think that you can diagnose it, don't. Always say suspected, unless they've given you in the candidate info that it's with a test result or saying that it's already diagnosed. Right? Otherwise, it's always suspected. Just always say that it's suspected, and the specialist will confirm it. Okay, and so that's a good way to take off responsibility, where you're saying that even if you're breaking a bad news, like even if you're saying it might be cancer, you're still giving them hope that it might not be, because there has to be a test that needs to be done. But I'm just telling you now because it looks like it most probably. All right.
Yes.
So here you just have to say that what I think is you have something called ADHD, and always explain that term, which is attention deficit hyperactivity disorder, which is always give the name of the thing. In this case, you don't have to tell the whole thing. You can just say ADHD. That's fine, because they can go and search. So think about it that way. Can the patient go and do more research? Like, have you given him enough information that he can go and do his own self research? That's all you need to think about.
And moreover, more than the research, also give it an easier way for them to remember. Like you can give them in the form of mnemonics, or in case of ADHD, since it's such a long name, you could have just said, it's also popularly called ADHD. And so that,
Okay.
it registers in their mind, because you're trying to counsel this person, right? And you can always layer it, like I suspect this is the case because of your inattention, and because of your loss of concentration, because of all that, it looks like this, but the specialist will confirm it, right?
And things that you missed specifically in the management is basically educational adjustments, right? Her main problem, she kept saying multiple times that I'm worried it might affect my studies. And make sure that you always pick up these things, where if you notice that the patient is trying to tell you something multiple times, always cover that aspect immediately after you give the diagnosis. Let's say that the specialist will confirm it, and then they'll tell you about the treatment. But that's not important right now. I want to talk to you about the main concern that you're having, which is your studies. And what I can do for you is I can talk to support groups, which will help talk to your college, and they can make special provisions for you, because it's not his mistake, right? It's a disease. So similar to any other disease that they have to make adjustments. It's similar to a disability, right? So there he's not able to study, and it's because of a problem in it's a biologic organic problem. So there's always provisions for it. So you just have to mention. So even if you don't know that what specifically will be done, always mention that there is always something that we can do. We will always take care of the patient, not just in terms of the disease, but holistically, right?
One other thing that you
Okay.
can do is that since you know that this is the diagnosis of ADHD, you know it's a disability. So once you understand it's a disability, then you are being a professional, and you are informing the university, saying that this person is diagnosed with this, he needs special attention, or there are a
Okay.
lot of resources. So you can always say, we can talk to social service, we can look into the resources, I can give you some leaflets and pamphlets. And your what you mentioned was that the medication will help. How do you
Yeah.
know? Sometimes you don't even
Okay.
know you're giving the medication. Medication is something that may be given by the specialist. That's also something that you need to understand. So
And I also noticed that you specifically mentioned that it will definitely help. Never say those statements at all. Be very careful whenever you're being definitive in these things. So never mention anything definitively. You can hear us, right?
it's all right. You can switch off your camera.
Yeah, yeah.
No, we'll just explain it to you. Right. So
And Yeah, you can finish that.
So that other thing about the definitive, like you were very sure that this is going to help. What you can say is the medication that you're going to be prescribed is a kind of stimulant. Even if you don't know the name, that's all right. You can just say what the medication is. It's a kind of stimulant that can help you with your concentration. It's also given for certain sleep problems as well. But you can just say it's a stimulant, and it should ideally help you, but we will have to monitor you and we'll have to see how well it's helping you. So the regular follow-up needs to be there. So when you said monitor, what you needed to actually say was that I will review you again. Since this is our first encounter, you'll go to the specialist will give you some management, and then we'll talk again on how it's improving your condition, right? So that is the monitor. The monitor is basically your review and your follow up that you're setting up.
Yeah, and the safety netting is something that you did specifically for driving, but always be a little more general whenever you're safety netting. Say that if you feel that, so in this, always think about what is the worst thing that can happen to any patient that comes to you. So, for example, in a psychiatric patient, the worst thing that can happen is suicidal tendency. So always put that in first in your safety netting. So driving is very important here, but don't skip the other one, which is basically self harm or suicidal tendency. Which all you have to say is, if you feel like this is affecting you more, and if you feel like you can't deal with it, we always have help, and I'll give you resources who you can call and talk about this. That is something that's very important. Safety netting in psychiatry, always mention the 24-hour helpline, or just in terms of telling them that it might get worse, and we have resources for it if it does. So that is something that you should always tell.
So another way of actually remembering that this is the safety netting that is needed, because this patient looks worried, he looks tensed, and if his academics performance without any additional help goes down, he has a tendency to get depressed. So this is definitely one of those candidates. So then you need to understand that this is a possibility, and I need to safety net for this, right? That's the thing that you need to understand. Like, what are the possibilities that this can go into?
And so this is something that we tell everyone whenever the 2-minute bell rings. So most of the time what happens is you might not have enough time to do the management, and most of the time, I mean, if you don't practice enough, you'll end up taking your data gathering till the 2-minute bell, and you'll only have 2 minutes for management. So this is something that helps a lot, which is basically whenever you hear the bell, keep three things in mind. These three things are basically safety netting, follow up, and leaflets and pamphlets. So can you repeat that once?
Uh, Follow safety netting and this leaflet we need to always say about.
Yeah. So these three things, because these three things will definitely give you 2 or 3 marks in management, even if you don't know the diagnosis, even if you don't know the management, you always have these three things to say, because safety netting is basically making sure that once the patient leaves your consultation room, that nothing will happen to them, that that you've given them enough information that they will be safe. That's safety netting. And follow up is similar to safety netting, where once you send them somewhere else, like either home or to a specialist, you still don't know what's happening to them afterwards, unless they book another appointment with you and then they come and speak to you. You will never know what happened to this patient. So always make sure you set up a follow up with yourself. So you always tell them, like, if suppose you are sending them to a specialist, always tell them that so the specialist will see you whatever it is, like whether it's a 48-hour referral or a two-week referral or a routine referral. Always tell them that whether the specialist sees you or not, you come back to me within a few weeks, or you don't have to specifically mention how many weeks. Just say that I'll set up a follow-up appointment for you within few weeks to see how you're doing, to see if the medication is helping, or see what if the management that I've given you is helping. So that is something that's very important, which is follow up with yourself, whether you send them to a specialist or home. Okay. And the third one is leaflets and pamphlets. which is NHS sprints like spends like almost billions of pounds just printing these leaflets and pamphlets for everything, like for every single disease, every single symptom, and they want you to give it to them.
So basically, what they actually want is that your patient is well informed. You have
Okay.
done everything in your power to inform him of his situation, right? That way, it's like
Yes.
the well educated patient is the best kind of patient. Then he'll understand what is needed for him, what is good for him. That's what you're trying to tell. So that way, if something that you must have mentioned he missed out or something, he can read it in the pamphlet. If there are certain information that he's looking for, he can read it in the pamphlet. He can go into the related websites and search more for himself, right? That's why you're giving the diagnosis as well, the name of the diagnosis, so that if they want to do any further research, and moreover, you're giving them material to actually do the research.
And so interpersonal skills wise, it's really good. Your rapport is good. You're empathizing really well, and your signposting also really well. The few things that you missed is always make sure you encourage them to ask questions. You keep saying, "Is that okay? Did that did that feel all right? What I said is that are you okay with this plan?" You just keep putting these phrases once in a while, and this it's okay. I think you got that. Your interpersonal skills were pretty good. The only thing that is follow-up appointment. This also comes in the thing where you're giving them more trust, that you're not just pushing them off to another person, where you're just telling them that okay, I'll see you again. So other than that, everything else is really good. So we'll just quickly go through this in-time guide, which basically shows you how you can cover this case in 8 minutes, basically. So this is a part of the OSCE workbench. I hope you had a chance to look at the Breaking Bad News module of the workbench.
Okay, I didn't check it yet.
Oh, sure. We'll send you a link.
Yeah.
So this case is also there actually. I can send you a link. So basically, what happens is you can basically see all the cases here. So we have around 477 cases. We've divided them into topics, categories, and subcategories. And you can select the case, and after you select the case, you have a overview of the entire case where you can read. Um, if you're only reading at this point, you can read all the cases first, and we have something called a practice mode. So which all you need is a practice partner who can speak English, and you can send them a link that they can use to mark, like similar to how I had marked you in a different device. So when they mark, when they act as a patient, and they mark you, they that gets saved into your account. And
So
similar
we'll
to
just
how
show what this simulator link looks like and how the marking is.
So there's a button here. If you click on this, it gets saved to your clipboard. Clipboard is basically something that whenever you copy, you can basically paste this. So the pasting is basically you can paste it in a WhatsApp message and send it to someone, and they can open this link, which will contain all the information that they need to have as a simulator, that they need to show what emotions they need to show, and what information they need to give, and what information they need to deliver at what point, and what are their eyes, and all the questions that they might have. And they can also mark you as you do this consultation, and which gets saved into your account, and you can track it as you practice every like multiple times. Also you can practice the same case, and everything gets saved in your account, where once they save, we can refresh it. And this is something that we are doing. So at this point, all the cases that Breaking Bad News has, which is around 13 cases that we could collect, and there's one Breaking Bad News for sure in every exam, and I think it'll most probably one of the variations of these cases that we've been seeing. And we managed to solve all the cases, and we have a 8-minute guide for each of the cases. I highly recommend you go through them, because Breaking Bad News is one of the most important topics. And so this is where it gets saved, and you can see the covered and missed like this, similar to how we just went through yours. And you also have a dashboard where you can track over time how you're doing, and what your progress is, how many cases you have done, and how much your average marks per domain, like data gathering, management, and interpersonal skills. And you can also see your detailed performance metrics, and over time how your performance is. And this is completely free for breaking bad news. And we highly recommend at least practicing one case every day, because that's the best. Like we tried the first time, uh, we read as much as we could, but only thing that actually helped us was
That's
practicing.
still not mean. This is my first time, like, this any kind of mock. This is first time. Even I didn't practice with my friends also that much. So I just read and read. I understand. I forget. I know everything, but when I'm starting, that time my mind is blank. That's
Yeah.
I think we went through that same process as well. Once you have so much information, you're like, what do I say now? Like, what was the medication? Oh shit. Like, am I saying the dosage right? It's not about the knowledge anymore. It's like, it's more about the conversation that you can have. That's what, no, once you understand it's something, you have to deliver it to the patient, give them the knowledge that you have gathered, right? That way, you're having a conversation on, helping them understand something that is wrong with them, right? So that's what you need to be doing, right? You need to be understanding what is wrong with your patient and have a real conversation with them.
yes.
All right. Any doubts? Is there anything else that we missed?
It was really a good session for me. It's very like good because I understand now how it should be. Yeah, so really grateful to you. Thank you.
Thank you. We are so glad to help. Yeah.
Yeah.
But once you get a hang of it, you'll also be, so proficient with, talking in a scenario like this, which is actually pretty useful.
Yeah. So make sure you practice. Make sure you practice at least one case every day.
Yeah, the Breaking Bad News module, like Rohit said, is available. So at least try with that. Understand how much
definitely I'll
you
try.
do. But yeah.
All right. All the
All
best.
right, all the best.
Yeah,
Thank
thank
you
you
very
very
much for
much
joining.
for your time. Yeah, thank you.
Thank you so
Okay.
much.
Thank you.
Okay.
Thank you for choosing TuringMedSchool. Good luck with your preparation.